So, you know, a lot of people say, I don't want to see doctor because the operation is painful. This is an old way of doing an operation called TURP. We use a telescope, resect it, you know, make a hole so that people can pass urine. Even though that is still practiced, but not necessarily have to be that, because they are now using laser. You know, laser is widely available across the country in order to help men with less bleeding, no irrigation, no problem with absorption of water, and less problem with erectile dysfunction. So men are scared to go and see doctor because they are completely ignorant of many knowledge. And laser treatment, you can see that this is the obstruction. After lasering, it's equally good like a TURP. So, lastly, cancer, right? Okay, prostate cancer actually happened in 1 in 6 of men. So, in a way, it is almost like a quiet epidemic that is happening. And with all these jokes about sexual dysfunction and things like that, the only thing that I think has happened is that we bring up a lot more awareness, a lot more ideas, and then a lot more discussion. Because, you know, these days and age, sometimes people ask me, hey, you forgot the shaver. You know, actually, I'm doing them. I'm doing David Beckham. Okay, right? Okay, well, no, actually, I'm James Bond, right? Because I'm actually looking for my Aston Martin, okay? Actually, today is 1st of November. It's no coincidence we picked this day, because for some of you, you might know that November in Australia, in UK, they call it Movember, because it's a mustache November, okay? So basically, this is a day that, you know, you grow a bit of mustache, a bit of fun. People ask you, hey, what's wrong with you? You say kind of like, I got good mustache. By the way, this is to promote discussion about men's health, because the more we actually discuss issues like prostate and things like that, then the less taboo it's going to be. So, you know, I sign up and it's going to grow some mustache and everyone has a bit of fun. You know, some people donate and that sort of thing. And then that is how I think we should go forward, that we break down that taboo. Because I think at the end of the day, I hope to convince you that one of the ways for men to catch up to the girls is because the girls actually dealt with all these in 1960s. They dealt with policies, they dealt with screening, they dealt with everything. This is a time for us to catch up. And also research. There's a lot more work we need to do about cancer, understanding it, research about treatment-seeking behavior. We need to reduce taboo, and then we also need to enhance our knowledge. And only with that, maybe, just maybe, one day, the unzipped men's health and the undressed woman's health is going to be equal. On that note, I thank you very much. Kimberly, I promised 3 jokes. I've only done 2. Am I allowed 1?
Sure.
All right, okay, right, okay. I'll show you this picture. Does anyone recognize where this is? Uncle Watt. Okay, right. I'll tell you something really funny about Lee household, okay? But you know, my kids think I'm a penis doctor. They always get very embarrassed every time I say, oh, you know. And then I said, children, be careful. Those penis pays for your education. So, okay, be respectful. Anyway, when I first came back to Malaysia after living in UK for 21 years, I promised myself that I want to visit all these UNICEF heritage sites, right? Okay. UNESCO heritage sites. Okay, so UNESCO heritage sites. And then this was one place that I really wanted to see. So I went there, I stayed in a hotel, I got the concierge to get a guide to take us there, and the guy said the best time to see it is early in the morning to see the sunrise. I said, fantastic. They said, we'll come and pick you up at 4 o'clock. Okay. So 4 o'clock, they knocked on the door and said, hello, are you ready for your tour? My children were going, oh. So we went there, and then 4 o'clock, my God, there were so many people standing there just to have a glimpse of the sunrise. So I stood there, and then this guy really wanted to bring up the spirit of my children and said, children, do you know how these people here, what are they praying for? My children said, for some sleep. Right, okay. I said, no. Everyone here is praying for hard penis. My daughter said, Jack, what did you hear? And then Jack asked the guy, said, what did you say? Hard penis, of course. I said, Ah, my daughter said, in Malaysia, you don't need to pray for hard penis. You go and see my dad. And my wife said, guys, you guys are disgusting. He said happiness. He didn't say hard penis. On that note, I wish you happiness and happiness. Thank you.
Thank you, Dr. Lee. Okay, we'll let you have a
sip.
Yes, a sip of water. We will now begin the Q&A session. Any questions from the floor?
Sir.
Okay, we have one question there.
I think we probably can hear you. Yeah, sir.
Okay, doctor, you have given us a very interesting talk on what happens to the person after he has got the disease. Well, we have the adage that says a man or a person thinks what he is. So if he has a positive attitude to life, does that have any effect on his own lifestyle?
Fantastic. I think that's a really, really good question. Actually, in reality, a positive mental attitude, first of all, make you love yourself more. When you love yourself, you exercise more, you eat healthily, you look after yourself, you have a positive outlook of life, that actually has tremendous amount of immunity boosting activities. And then there's a lot of study that shows that. So that is before a disease occurs. And we have almost huge amount of data to show after the disease occurs. For strange reasons that we can't explain, whenever we have the same cancer that happens in two different individuals, one individual constantly gets trapped in why me attitude. The other individual wakes up every morning and says, my goodness, that's another day I have that I think I should not have. And that person, the second person, always, without a question, always live happier, with less complications, with less problems afterwards. And it's all in the brain, it's all in the mind, and that itself is actually a very important positive mental attitude. Okay. I'm going to give you a story, okay? This is a true story. 2 years ago, I was burgled, right? Okay. When I was burgled, these guys came to my house, tied me up, and beat the crap out of me. And then I actually was quite naked. I was naked. I said, can I put on my trousers? And then they came in and said, whack the crap out of me. And then for 6 months, I actually was really, really depressed. I was thinking, why me? Why did it happen to me? And that sort of thing. And then I got even more depressed whenever the police who came to actually interview me actually said to me, look, come on lah, it's like, he didn't kill you, man. Right? Okay. And then say, no, he only took some watches, could be worse, and that sort of thing. I felt angry. But actually, after 6 months, my kid, my son, 14-year-old son, came to see me and said, Dad, are you still upset? I said, yeah, of course I'm upset. And then he said, look, but we're still together, right? So every day is like a bonus, right? Okay, why are you so upset? No? So it's almost like what the police said, he didn't kill you, man, right? Okay. The other thing my son said to me was that, did we lose many things? I said, your granddad gave me some watches that I quite like to keep, but they took it away. And then, my son said, maybe granddad knew they were coming, and this is supposed to exchange for your life. I was thinking, yeah, maybe that's true. Okay. Seriously, I learned a lot of things from my patients, a lot of things. For those of you who read Chinese, I wrote a book called 医院我的乌托邦. It's a hospital, my utopia. It's almost every day I've learned so many things from my patient. There was this guy who actually, at the final moment, he said he was dying, and then he started let go. There's no more, Chinese, we have a lot of yen with or your brothers, your sisters, someone owe you money 10 years ago, and that sort of thing. And he said, it doesn't matter anymore. I've got cancer, but every day I want to forgive, I want to let go. I learned so much from him. There was a 28-year-old woman who had a bladder cancer, and I operated on her, it came back. And I said, I'm really sorry, I feel like I failed you. She said, doctor, every day I take a breath. I take a breath. and I feel that this breath I shouldn't own, and I'm already happy with what I have, rather than chasing things that I don't have. And that itself makes me happy. And seriously, you're absolutely right, positive mental attitude makes a lot of difference. And sometimes we learn a lot of these from people who actually face with adversity and look at life very differently. And that is a very good thing to do. Thank you.
We have another question
Sir.
from the gentleman there.
Doctor, a very, very interesting talk. The 1 out of 6 is a little scary number that you showed over there.
1 out of 6.
1 out of 6. So I had a question related to that. My father died of prostate cancer 7 years back. So does that mean that I have a greater possibility of the prostate cancer? That's my first question. My second question is that I consulted a urologist at one time, and he said that if you have an enlarged prostate, as long as it doesn't bother you with urination, you don't have to worry about it. But from your data today, it made me wonder whether that's actually a correct thing or not, because you said it complicates things for later on.
Okay, 2 questions, perfect question. The first question is the hereditary factors of prostate cancer. If your father actually contracted prostate cancer much earlier, so in his 50s, then the risk of you having prostate cancer is much higher, right? Okay. And also, if his prostate cancer is actually of higher grade, then the risk of actual hereditary is much higher. So technically, there are studies that's done looking at all people who died at age of 60, 70, 80, 90. We realize that, let's say if I take an 80-year-old and then who died of anything else and take their prostate out to have a look, virtually 80% of these prostates will have some degree of cancer. So what I'm trying to tell you is that if you live long enough, you will get it. However, only 2% of those people who get prostate cancer will die of prostate cancer. So most of us will die with prostate cancer rather than die of prostate cancer. So will you get it? If you live long enough, you will get it. But will you die from it? The chances is no. The problem now is that as a scientific community, as a clinician, we can't tell who are the ones who's going to die from it, who are the ones who are not going to die from it. And that is a challenge we have, trying to identify who are the ones. At the moment, we are doing something really, really not nice, which is everybody who gets prostate cancer, take it out. And that's not the right thing to do, because earlier on, I come across some of you who actually say that, I have prostate cancer, Gleason 3+5, which is 5, which is not very aggressive, but the doctors say take it out to be safe, to be sure. But that taking it out may make you incontinent, may make you impotent, and may make your life so much worse, and you may not die from this condition. So one of the problems we have is that we are so behind in research work that we actually don't really know how to identify the people who don't die of prostate cancer rather than die with prostate cancer. And that is a very good challenging thing to say. The things that you mentioned about, the majority of people, the urination problem is inconvenience. However, you need to get it checked out, because that inconvenience itself might be a first signal to tell you that your kidneys are failing. So whenever you get it checked out, the urologist say to you, you flow better, you wake up once at night, then you go to sleep. You sleep, but your wife didn't sleep, right? Okay, so that sort of thing, actually, it's our job to make sure that you're safe, and it is our job to make sure that you can continue to monitor it without any fear of kidney failure, so on and so forth. So that's a perfect question. Thank you very much for that.
We will take one question from this side.
Yes.
Any questions from this side of the hall?
Yeah.
My Gleason score was 6, and my prostate were removed.
Yes.
So was it
Well, it very much depends. Gleason 6 is bang on in the middle, right?
Yes.
Okay. So earlier on, I had somebody who actually had Gleason 2+3. If you're Gleason 6 and then your prostate PSA to start off with is quite high, let's say about 7, 8, 9,
which was 5.3?
5.3, might be a bit too premature, because there is a study called Homburg that was done in Scandinavian countries. They take patients in your situation, they randomize one group to operation, one group to nothing. In 15 years, there's no difference in these two groups. The life expectancy is the same. It's only 15 years after it's going to make a difference. So for you, it depends on how the rest of your body is functioning. If let's say you've got cardiovascular disease and all sorts of problems, then the chances of you having problems with those diseases is higher. So it might be the right thing to do. Looking at you, you look very, very young. So therefore, to prevent it, it's a good idea. However, if you look at that, it's only benefiting people who live beyond 15 years from the point of surgery. So 3 plus 3 is a little bit borderline. If you're 3 plus 4, 4 plus 3, then definite yes. If you're 2 plus 3, definitely no. But these days, in the States, even in the States, a litigation prevalent country, you will get people who are monitoring 3 plus 3 with that PSA only operate on it when it goes up. And therefore, it is a good idea to do. And thank you very much for sharing that, because not many people will be brave enough to talk about their problems like that, and thank you for that. Okay, round of applause, guys. Your chance of survival is good, because your PSA should be 0 now. Yeah, so your survival will be excellent. Yeah.
Any chance of recurrence?
No, virtually none, because we wipe it out. Because this is the whole aggressive way of just take out as much as possible. But there are many people who will remove it unnecessarily to protect you from getting recurrence. Yeah, so it's almost a collateral damage just to be safe. Yeah. Okay. Thank you.
Okay, due to time constraints, that's actually the end of the Q&A session, but if you have any questions, you can actually approach Dr. G after the session. So we are going to conclude the session now. Thank you very much, Dr. G, for the highly informative and entertaining lecture.